Good morning. Thank you so much for this opportunity to be here and present my work. So my name is Binh Phan. I'm a PhD student at the University of Manchester. I'm working with Dr. Zenas. So today I'm happy to present about my PhD project. The title is the evaluation of tumor necrosis factor inhibitors biosimilars for psoriasis. So the name sounds like it came from a fiction movies, but hopefully in the next 10 minutes I will have the chance to explain to you what I'm going to do and what I have done in my project so far. So my project is funded by the Psoriasis Association, and throughout my talk today, you will find out that Psoriasis Association not only fund this project, but extensively support me during the process of these projects. So before my talks, I want to declare that I have no conflict of interest to disclose. So Dr. Zenas have mentioned about biologic treatments, and I want to continue his discussion on biologic treatment. So let's use Humira as an example for biologic treatment. So Humira is a biologic drug. Like any other biologics, it is produced by a living organism. It targets a specific part of the immune system and help to control for psoriasis. It is quite effective. It is relatively safe if we compare them to conventional treatment, and that's why they are used for moderate to severe psoriasis. And Humira contains an ingredient, a substance, a biologic molecule called adalimumab. So if we put the adalimumab next to a chemical drug, traditional chemical drug, let's say in this example aspirin, you will see that adalimumab looks like a giant alien thing. So now the question is, if someone wants to replicate this medicine, I think they will have no problem replicating an aspirin. But in terms of replicating the adalimumab molecule, it can be a big trouble. So this brings us to the concept of biologics and biosimilars. So when adalimumab first available, it's only one company producing adalimumab under the name of Humira. So Humira is the originator, the first form of adalimumab. And 10 years after the introductions of adalimumab, other pharmaceutical companies also produce their own versions of adalimumab. And these products available in different names, and they are called the adalimumab biosimilars. So by definition, these are the drugs that have the same amino acid sequence, the main structures as the originator adalimumab. They have the same mechanism of actions, but because the adalimumab molecule is so complicated, it is not, the biosimilar is actually not identical to the originator adalimumab Humira. They have different manufacturing process, and they also have some different inactive ingredient. So the benefits of introducing this biosimilar is that they have a lower price, so they will reduce the cost of treatment, and potentially with that, we will have better access to the treatment. The more people will have access to the treatment. However, there's a concern because of these differences between these biosimilars and the originators. We want to ask whether this biosimilar work as well or as effective and as safe as the originator biologics. And in order to understand that more, at the beginning of the project, I collaborate with the Psoriasis Association to conduct an activity called the patient and public involvement. And throughout these activities, I work with people with psoriasis. I work with people using biologics to understand their interest, what they want to know about biosimilar. So first, I launched a survey which is advertised on the Psoriasis Association website. And secondly, I have a meeting with a group of people with psoriasis who are using biologics for their psoriasis. So the results I found that people want to know about the safety, the effectiveness of biosimilars for psoriasis, and they also want to know about the distribution and the accessibility to biosimilar across the country. So using this information from the patient and public involvement activities, I designed my project. So the project is designed based on the public interest, and we set the two primary aims. The first is to describe how biosimilars are being used and distributed across the UK and Republic of Ireland. And the second aim is to compare biosimilar with the originator for psoriasis in terms of treatment persistence, effectiveness, and safety. And in these projects, we use data from BADBIR, and like you have heard in Dr. Zena's presentations, BADBIR represents more than 160 centers across the UK and Republic of Ireland, so it is one of the best databases we can use to understand the use of biosimilars for psoriasis. So for the first objective of my project is to understand the use of biosimilar across the UK and Republic of Ireland. So I use the data I have from BADBIR with a little bit of my art skill from A-level. I was able to draw these maps. So it looked a little bit like the BBC election headline, but let me explain this a little bit more detail. So the maps in blue representing the rate of people switching from the originator to biosimilar, and the maps in red representing the rate of people starting their treatment, new treatment with biosimilars. And those areas with a darker color is the area with a higher rate of using biosimilar. And from this graph, we can see that there is significant variation in the rate of people adopting biosimilar for their treatment. So why might be the reason? So the reason might be the differences in the local policies about using biosimilars, and the variation might be because of people perception, doctors and patient perception toward biosimilar. So in the second objective of my projects, I'm start to comparing the treatment persistence, which is the probability that people will stop their treatment. First, I comparing starting the treatment with biosimilar and starting the treatment with the originator. And second, I compare someone who switched from the originator to biosimilar and someone who remain with their originator treatment. And as you can see here from these two graphs, people who switch from the originator to biosimilar actually was more likely to stop their treatment. So what might be the reason here? The reason is when people switch to the biosimilars, they're very likely to have a negative perception toward biosimilar because they know that it's a cheaper treatment, and the common sense is a cheaper product normally is a product with lower quality, even though we haven't have a clear evidence for that yet, but that might contribute to the reason why people start stopping biosimilar treatment. And the second explanation is that when switching to biosimilar, people need to handle a new injection device, and with a new injection device, people was more likely to have an injection reaction, and with the injection reaction might lead to the discontinuation of these new biosimilars. And with the final objective of the project, I directly look at the treatment effectiveness and safety of biosimilar in comparison with their originator products. So again, I compare starting biosimilar with starting originators. I compare switching to biosimilar with continuing the originator treatment. And the graph here showing you first is the probability of people achieving a PASI of 2 or less in 1 year of treatment. And the second graph on the right-hand side representing the risk of having a serious adverse event that leading to hospitalization. And you can clearly see from this graph, we found biosimilars are as effective and as safe as the originator for psoriasis. So what are the conclusion here? So our conclusion is that there are differences in how biosimilars are being used across regions of the UK and Republic of Ireland. Biosimilar works as well as their originator and as safe as their originator for psoriasis. However, people who switch to biosimilar were more likely to stop their treatment comparing to those who remain on the originator. So these results will directly inform doctors and patients who are using biologics and biosimilar for psoriasis. Is that it will ensure people that biosimilar is work as well as the originator for psoriasis, and it's also raised the awareness about, like Dr. Sena had mentioned, it is talk about the communication and information between doctors and the patient when switching from the originator to the biosimilars. And the results of my projects have been published in several scientific journals, as well as have been presented in multiple national and international conference. And coming next July, it will be presented in the British Association of Dermatology's annual meeting in Manchester. And in the future, if I have the chance to expand my projects, I want to look at people who switch back to the originator after using biosimilars. I want to understand why people might want to switch back to the originator after they're using the biosimilar, and what is the consequence of that switching back to the originator. And I also want to look at the cost and the economic benefits of biosimilars that can bring to the treatment. So this will answer the question. I think this will contribute to the answer whether we can use biosimilar earlier in the treatment if it have a clear evidence of cost and benefit. And thus, I come to a conclusion of my presentation and want to thank you for this support from the Psoriasis Association. I want to thank my supervisor team, and I also want to have a special thank for the focus group who helped me to design the project, and the name is presented in my slide, and I'm happy to answer any relevant question. Thank you so much.
Sure, Dharani, University of Manchester. Thank you, Binh, for a fantastic talk. The question, so is cost the only effect of changing to biosimilar, or is there any specific reason for the patients who are changed from origin to the biosimilar?
So thank you so much for the question. That's a very interesting question. So for now, the main reasons that we observe the transitioning from originator to biosimilar mainly driven by the lower cost of biosimilar. So with lower cost of biosimilar, we can reduce the cost of treatment, and hopefully it will improve the accessibility to this treatment. So that is the main reason now we are using biosimilar.
Around during the coffee break,
yeah.
So perhaps people have other queries about really very interesting findings, so we'll come back to you, but thank you.